Ebola is caused by the Ebola virus, which belongs to the Filoviridae family. The first known Ebola outbreak occurred in 1976 in Zaire, now the Democratic Republic of Congo. Ebola is a severe and often fatal disease, with mortality rates ranging from 25 to 90%. The virus is known for causing hemorrhagic fever, internal bleeding, and shock. Mpox, also known as monkeypox, is a viral zoonotic disease caused by the monkeypox virus, a member of the orthopox virus genus, which also includes the smallpox virus. Mpox primarily occurs in Central and West Africa, but recent outbreaks in non-endemic countries have raised global concern. COVID-19 is caused by the SARS-CoV-2 virus, a member of the coronavirus family. It emerged in December 2019 in Wuhan, China, and quickly spread worldwide, resulting in a pandemic. COVID-19 primarily affects the respiratory system, though it can have multisystemic effects. The transmission routes for Ebola, Mpox, and COVID-19 vary considerably, influencing their spread and control. Ebola transmission. Ebola is a zoonotic disease. It is transmitted to humans through direct contact with the bodily fluids of infected animals, particularly bats, primates, and antelope. People can also contract Ebola by consuming bushmeat from infected animals. Ebola spreads through direct contact with bodily fluids, such as blood, vomit, feces, and sweat, of an infected person, especially during the later stages of the disease. The virus can also spread through contact with contaminated surfaces, like bedding or medical equipment. Unlike COVID-19, Ebola does not spread through airborne droplets, making close contact and exposure to bodily fluids the primary mode of transmission. Mpox transmission. Similar to Ebola, Mpox is zoonotic. Humans can become infected through contact with the bodily fluids of infected animals, or by consuming undercooked meat from these animals. Mpox can spread through direct contact with skin lesions, respiratory droplets during prolonged face-to-face contact, or contact with contaminated objects like bedding. Recent outbreaks suggest Mpox may also be transmitted through intimate or sexual contact, particularly within certain high-risk populations. COVID-19 transmission. COVID-19 spreads primarily through respiratory droplets and aerosols when an infected person coughs, sneezes, talks, or breathes. The virus can also spread through close contact, especially in crowded or poorly ventilated areas. Though less common, SARS-CoV-2 can spread via surfaces if people touch contaminated surfaces and then touch their eyes, nose, or mouth. COVID-19 is notable for its ability to spread via asymptomatic individuals, making control and containment more challenging compared to Ebola or Mpox. The symptoms of Ebola, Mpox, and COVID-19 differ significantly in severity, onset, and affected body systems. Ebola is known for its rapid onset and severe clinical presentation. The incubation period ranges from 2 to 21 days. Initial symptoms include sudden fever, severe headache, muscle pain, fatigue, and sore throat. As the disease progresses, symptoms can include vomiting, diarrhea, abdominal pain, internal and external bleeding, also known as hemorrhagic symptoms rash, and in severe cases, organ failure and shock. Ebola is highly lethal, with mortality rates reaching up to 90% in some outbreaks depending on the healthcare infrastructure and timing of intervention. Mpox is less severe than Ebola, but presents with a unique set of symptoms. The incubation period is typically 7 to 14 days. Initial symptoms include fever, headache, muscle aches, swollen lymph nodes, and fatigue. The rash starts as flat lesions that progress to raised pustules, eventually scabbing over. It typically begins on the face and spreads to other parts of the body, including the palms, soles, and genital area. Most Mpox cases resolve within 2 to 4 weeks, and the mortality rate is relatively low, ranging from 1 to 10%, particularly when proper medical care is available. COVID-19 symptoms can really vary, ranging from asymptomatic cases to severe respiratory failure. The incubation period is typically between 2 to 14 days, with an average of about 5 days. Common symptoms include fever, cough, shortness of breath, fatigue, loss of taste or smell, sore throat, muscle aches, and congestion. Severe symptoms can include difficulty breathing, persistent chest pain, confusion, and low oxygen levels, also known as hypoxia. Complications from COVID-19 can lead to pneumonia, acute respiratory distress syndrome, multi-organ failure, and in some cases, long-term effects such as long COVID. Treatment protocols for Ebola, Mpox, and COVID-19 vary based on the nature of the viruses and the available medical interventions. Ebola, well, it has no universally approved treatment, but recent advances have led to the development of experimental therapies. Supportive care, including hydration, maintaining electrolyte balance, and oxygen therapy, is critical. Antivirals and antibodies, such as treatments like remdesivir and monoclonal antibody therapies like Inmazeb, have been used with some success. Experimental vaccines, like the RVSV-ZBOV vaccine developed during recent outbreaks, have proven effective in preventing Ebola. Mpox treatment. There is no specific antiviral treatment for Mpox, but supportive care is effective. Supportive care includes treating fever, pain, and preventing dehydration, which is standard. Antiviral drugs like tecovirimat, also known as TPOXX, have been approved for severe cases of Mpox. Additionally, the smallpox vaccine provides cross-protection against Mpox, and post-exposure vaccination can be used to reduce the severity of symptoms. COVID-19 treatment. COVID-19 treatment has evolved rapidly. Antivirals such as remdesivir and molnupiravir can reduce the severity of illness. Monoclonal antibodies are used to prevent progression in high-risk individuals. Steroids like dexamethasone are commonly used to treat severe cases, particularly those requiring oxygen therapy. Vaccines, including Pfizer-BioNTech, Moderna, and Johnson & Johnson, have been rolled out globally, drastically reducing the severity of cases and transmission rates. Global impact. Ebola's global impact. Ebola outbreaks have primarily affected Central and West Africa, but their severity has prompted international responses. Localized outbreaks, though deadly, Ebola outbreaks have remained geographically limited due to its transmission method, direct contact with bodily fluids, and the rapid isolation of cases. Public health responses. Outbreaks have spurred global health organizations, including the WHO, to prioritize containment efforts and develop vaccines. Mpox's global impact. Mpox outbreaks were historically confined to Africa, but recently spread to non-endemic countries. Global concern. The 2022 Mpox outbreak in Europe, the Americas, and beyond has raised global health concerns. Containment measures. Public health responses have included contact tracing, isolation, and vaccination campaigns. COVID-19's global impact. COVID-19 has caused one of the most significant global health crises in modern history. Pandemic spread. Unlike Ebola or Mpox, COVID-19 spread rapidly across the globe, affecting nearly every country. Economic and social disruption. COVID-19 led to widespread lockdowns, economic shutdowns, and significant disruptions to daily life. Vaccination campaigns. Mass vaccination efforts have played a crucial role in reducing the severity of illness and controlling the pandemic. Conclusion: comparing Ebola, Mpox, and COVID-19. Though Ebola, Mpox, and COVID-19 are all viral diseases, their differences are stark in terms of transmission, symptoms, treatment, and global impact. Ebola is the most lethal, with rapid onset and hemorrhagic symptoms, but its transmission is limited to direct contact with bodily fluids. Mpox is less severe, characterized by a skin rash and flu-like symptoms, with a recent global resurgence. COVID-19, while less deadly than Ebola, has had the most significant global impact due to its rapid transmission, airborne spread, and ability to affect people asymptomatically. Each disease underscores the need for strong public health responses, global cooperation, and continued medical innovation.